Well, good evening, everyone. It's so wonderful to have so many of you with us. I think this is our largest event that we've done since we went back to doing in person, which is really wonderful. So thank you for joining us tonight. For anyone who I've not yet met, I'm Francesca Ogiman-White, and I'm the founder of the Beauty Triangle. So as you'll all know, we're here tonight to talk about skin, because whether it's breakouts or open pores or pigmentation or the first signs of aging, I think we can all agree that skin is one of those things that really affects the way that we present ourselves to the world. And it also affects and influences our sort of self-confidence and self-esteem. And one of our missions here at the Beauty Triangle has always been to educate and empower consumers about all of their health and wellness, and always from a holistic standpoint. But it's also been to connect you with the very best experts in the world of wellness. Which brings me to my amazing lineup of ladies who we have here with us tonight. I'm so thrilled to be joined by founder of Adonia Clinic and aesthetic doctor, Dr. Ifeoma Ejikeme, also by ophthalmologist and oculoplastic surgeon, Mrs. Sabrina Shah-Desai, and by celebrity facialist and the founder of Skinisa Skincare, Sarah Chapman. And really, they're going to be here and they're going to be helping us to get our complexions back under control. So that's everything from the topicals we should be using to the role of technology in treatments, and even the more sort of hands-on techniques that we can be using back at home in our bathrooms. Before we delve into the conversation, just a few things. Hopefully you've all found a program on your seats. Attached to the back, there's also a referral card. So if you'd like us to connect you with anybody that you hear speak here tonight, just tick the box next to their name, leave your email address, and we will send an email connecting you. It's that easy. And we've got a Q&A at the very end. So if you have any questions, please just pop up your hand at the end and we will come to those, I promise. And we also have an amazing goodie bag for you when you come to leave. So we've got treats from Get Harley, Epiance, Teoxane, Advanced Skin Nutrition, and Skinesis. So yeah, some real treats in there. So please don't leave without picking one of those up. Enough chat from me. I'm going to hand over to our amazing panelists. They're going to say a very quick hello, introduce themselves, and then we'll get cracking with the main conversation. So Dr. Ifeoma.
Hi, everybody. Is this working? Hello. So my name is Dr. Ifeoma Ejikeme. I'm the founder and medical director of Adonia Medical Clinic, a skin, hair and wellness clinic based in Maida Vale. My background is in general medicine, and then I have specialist training in head and neck surgery, and then advanced training in aesthetic dermatology and aesthetic medicine. That's my background.
Fantastic. She's really fantastic. I'm Dr. Sabrina Shah-Desai, so I'm an ophthalmologist and an oculoplastic surgeon. What does that mean? It means I operate on everything to do with your eyelids, and so that's my day job. I also do the non-surgical treatments, so I love everything about eyes, and I try and offer the whole gamut of treatments, both surgical and non-surgical, around the eye. And I'm delving into the topical skincare, but I'm not doing skincare for the face. It's only related to the eyes, and we'll talk more about it later.
Hi, I'm Sarah Chapman. I have a skincare range, Skinesis, and also a facial clinic, and very much focusing on skin and this. So nothing really body-wise particularly, but all about the face, not yet. Getting the skin really healthy, keeping the skin in really good condition, enhancing the skin's glow, and looking at obviously skin issues, but also skin concerns as we go through the year, and how you actually deal with those and look after your skin in the best possible way.
Such an amazing lineup. Thank you so much, ladies. Really excited to speak with each of you tonight. But first, starting with Dr. Ifeoma, thank you for joining us once again. I mean, you touched on it, Ifeoma. You're an injectables expert. Those are my words, not yours. But I mean, you often actually start with skin before you even get to sort of pulling out your needles. Why is that exactly?
So if you think about the face, structure of the face, you have the bones, you have the fat, you have the muscle, and you have the skin. So if we're going to look at some of the biggest issues that people have, usually it's things like hyperpigmentation, redness, dull skin, skin sensitivity, irritation. Those are the things that you see every single day. And yes, there might be lines, there might be wrinkles, but if you don't address them first, you're really doing the skin an injustice. Yes. Because sometimes I find that by actually stimulating the dermis, improving the skin quality, you don't need as much injectables, or you don't even need them at all.
That's interesting. And I guess as well, we so often talk about the sort of relationship between doctor and patient. And it must be so nice as a means to actually get to know your patient before you go in with the sort of heftier sort of stuff as well.
Yeah, It's a relationship, and they have to trust me and I have to trust them as well. It's a two-way street. So you have to make sure that I have the right aesthetic for my patients. I have a very, very gentle aesthetics. It's all about you and your best self. I'm not trying to recreate the face or change anything. I'm trying to enhance what's already there. Now, if somebody does want that very contoured, highly augmented look, I'm just not the right person for them. So that has to be that, make sure that I'm right for them and they're right for me.
No, 100%. I mean, each of us has different skin and different concerns, yet, are there any sort of core skincare ingredients that all of us could be benefiting from?
Yes.
Please elaborate.
So I would say for me, there's 5 main elements in skincare. First of all, you cleanse, your antioxidant, your moisturizer, and your sunscreen, and then your treatment step. But in terms of what everybody needs, it's sunscreen, in fact, 30 or above, irrespective of your skin shade. That would be absolute number 1. Number 2, I think something that's quite underrated that I've struggled to find someone who couldn't benefit from it is niacinamide.
I feel like everyone is talking about
Yeah.
niacinamide at the moment.
Yeah.
And why is that?
Well, niacinamide is a really interesting skincare ingredient because it can help stimulate collagen, and we know that as we increase in time, we lose collagen. So we lose that bounce and flexibility, and niacinamide can help to stimulate that. If you have dry skin, it can help to hydrate the skin. If you have oily skin, it can help to balance the oils. It can help fortify the barrier function of the skin. We're all addicted to retinoids. I know I am. And it's one of those ingredients that works so well with the acids that we love to use and the retinoids that we love to use. So it's such a supportive ingredient. And you can find it in so many blends, in so many formulations as well.
And is there a difference between what we should be using at this time of the year, sort of being in peak winter, versus what we then need to be getting into our skincare regimes in summer?
I'd say yes, especially for the majority of people. Now your skin might be feeling dry, parched, so you really want to lean into ingredients that can pull moisture from the skin, pull moisture to the skin, like glycerin, like niacinamide, like hyaluronic acid, but don't stop there. Seal it in with a good moisturizer that will keep it there. I think in wintertime, sometimes you can rely on these sorts of humectants that can actually leach moisture from the skin if you don't seal them well in the wintertime.
That's true. I think it was you that said to me when I go on the aeroplane and I was saying, I always put these eye patches on, and you were like, that's the worst thing you can do. Put a thick layer of moisturizer on, stop all of the water from escaping. What from your experience are your patients' main concerns when it comes to your skin? You must see sort of all sorts of complaints coming out.
I would say dryness, dull skin, uneven skin tone, and probably number 1 is hyperpigmentation. Yeah, in terms of skin concerns, hyperpigmentation, and then a close second, I think, from hyperpigmentation is redness. So those would be the 2 I think people are most concerned about.
And do you think anything's driving those sort of right now? I mean, we've sort of spent the last 2 years talking about maskne as a result of wearing face masks and sort of, anxiety over our skin because of COVID. Do you think any of the sort of like redness that people are complaining about, is it sort of lifestyle changes? Is it sort of just life and stress that we're living through?
I think it's variants of normal, that we've just spent a long, long time looking at our faces on Zoom in the mirror for far too long. And we're seeing what was already there. If you have darker skin types, hyperpigmentation is bread and butter. It's just going to be there. It's just about managing it. If you have a lighter skin type, you're going to have redness. And it's just, again, about managing it. And so having a year and a half of no makeup and looking at our skin with no makeup, we're really seeing our skin sometimes for the first time and getting to know our skin and getting to re-love our skin. And then that means without makeup, without injectables, without anything, you're just at home in lockdown, what else have you got to do? You now have to rely on your skincare to get you to where you need to be. And I think that's why people are focusing much more on bare skin and natural results.
And do you ever see sort of things like hormones sort of affecting your patient's skin? Because that's the one sort of culprit that seems to crop up time and time again, sort of breakouts and particularly going through sort of perimenopause, menopause even, we see such dramatic differences in our skin, don't we?
Yes, huge. Hormones play such a huge impact in so many different conditions of the skin that are normal: flushing, redness, hyperpigmentation around pregnancy, around menopause, the interaction between hormones and the sun. So a lot of the skin issues that we have some basis in hormones. So, but then, we can't stop them. We can't stop the hormones. We need those hormones. So it's just about having a routine in terms of skincare, in terms of peels, all the rest of the treatments that you do that will help get you to where you want to be. But your skincare is always there as your maintenance in between.
And I really want to talk to you about all the peels and all the exciting things that you do in clinic. But first, I mean, you just sort of spoke about sort of the correct skincare. Is there sort of reason to believe that also using the wrong skincare sometimes can also aggravate all these conditions that you're talking about, the redness, the hyperpigmentation, all of those things?
Absolutely. I don't know if anyone remembers the craze of the 15-step skincare routine. Remember that?
Like the Korean skincare routine. I think it was like 17 steps.
Yes,
it's nuts.
it's a lot. And I think that encouraged a lot of people to look for ingredients. Like, I want to have a retinol. I need glycolic acid. I need lactic acid. I need salicylic acid. And you had these routines where you're putting, an acid in your cleanser, an acid in your serum, an acid in your moisturizer. And that leads to irritation. Yeah, irritation leads to redness in certain skin types, leads to pigmentation in other skin types, dryness, and worst of all, sensitivity. And that's when you put whatever you put on your skin, nothing seems to work. And that's when you've kind of gone into sensitivity now. And so yes, certainly whilst there's some absolutely amazing ingredients, all the ingredients I mentioned can be great for the right people. It's about paring it down to a really lean skincare routine and then dipping into your actives really only when you need them and only for a specific purpose.
And I guess as well, doing your research or sort of going to the right people to get this information so that you're not just sort of self-prescribing skincare and mixing things up because, we've all seen sort of horror stories where it's gone wrong. I mean, tell us about the peels that you just mentioned, because I feel like you've said this to me before. Ifeoma has a peel for every single skin color, skin type. I mean, in your clinic, it's how many peels do you have? You told me
over
this.
50.
Oh, that's amazing. Most clinics have a peel or two if you're lucky.
So I started off that way. I started off with one brand and thought, okay, this can do this. And then I had a bunch of patients that it didn't adequately treat. Then I went to another brand and another brand, and another brand. And that's how we ended up with 50, actually more now, even got more. So, and the reason for that is because of one of our core missions in the clinic is to be able to effectively treat every single skin type. Whether you are always burns, never tans, to the deepest, darkest brown that never tans as well. So, and every shade in between, from your mature skin, dry skin, sensitive skin, sensitized skin, those that need preparation to get to the right place, those that don't. So you need lots of different options to be able to adequately treat.
What's your most popular peel that you offer in the clinic?
It goes through phases, but right now there's a peel that we have that's the VI peel, and it's the Purify with Precision Plus, and it's a combination peel that addresses hyperpigmentation and acne at the same time.
Oh, that's really good.
It's a peel that, whilst you don't need prep, you can do it on every single skin type. And it has some great ingredients in it, including phenol, which is a really interesting ingredient that when you put it on the skin, it doesn't burn. So you can do a peel that's a medium depth peel with no pain.
Without the sensitivity.
Without
That's
the
so
sensitivity,
clever.
so it's nice peel.
And what was I just about to ask you about peels? My mind's gone blank. Oh yes, is there any prep that you have to do before them? Because you just said some of them you prep for, some you don't. I mean, or is that all handled sort of by you in clinic?
Yeah, so we actually prep all my patients all the time, irrespective of their skin tone, before every peel. Now, that's not required. So if you've had a peel and you haven't prepped, doesn't mean they were doing it wrong. That's just our process, because I have a long-term view. With all my patients, I have a really long-term view. If you come in and we do a great peel and you go away, 2 weeks later, your skin will change. That's just the truth. Your skin will start to go back to where it was before. So peels can be used as an exfoliating step, but your peel is not your skincare. Your peel is kind of the thing, the trampoline that will move you on to the next level. So if you prepare the skin, or at least get into a good skincare routine, that's prep. A good skincare routine is prep. And then you do the peel, you're going to have a much better result and a long-term result, as opposed to just coming in, getting the best peel in the world, and then going back to soap and water and no sunscreen. So it's about having a long-term view with skin and doing things that lead to long and consistent change in the skin.
No, you're right. And I think the sort of good thing about the peels that you do as well is that, they're so transformative. Like you say, you will get the results from doing them. And I think that can be so gratifying, particularly if you're saying pigmentation, blemishes, they're things that really do sort of damage people's self-confidence. You're also a sort of, real pro when it comes to all the energy-based devices. So things like laser. I mean, do you find that laser treatment is one of those other things that really helps to restore skin confidence?
Absolutely. So you can do so much with laser with the right skin type and the right prep, different prep for lasers, but absolutely. So we have some lasers that can be helpful for laser hair removal. They can be helpful for vascular issues like the redness, the vessels that you see on the face or the body, for hyperpigmentation and dark spots or sunspots. They can be used for resurfacing, large pores. Even for hair loss now, there's some lasers that you can help for hair loss. So there's so many different energy, not just lasers, but energy-based devices like high-intensity focused ultrasound for tightening the skin.
Oh, that's a really nice one, Makes you all sort of cheekbony and chiseled after you've had it.
And for the body, as well, fat freezing and M-Sculpt. So we have a few energy-based devices for the body as well that can be helpful.
I mean, that's the thing, we're talking about skin sort of focusing on the face here, but it does go all across the body, doesn't it? And I mean, I'm sure you must see sort of a lot of these conditions we've been discussing tonight affecting other sites of the body as well.
Absolutely. Spots happen on the back, on the bum, on the legs, on the arms, Pigmentation happens in between the thighs and the underarms. It's everywhere. So I have a lot of the concerns people have. It's not just about the face. It's all over, it's knees that need firming up or people that want to have their knees firmed up. Loads of different areas of the body.
No, and I think we've seen such a shift with all these sort of skin boosters that, you can now hydrate the tissues all over your body. It's so exciting. Tell us a little bit about the IV infusions you do, because these are a really sort of smart way, I feel, of approaching the skin from an inside-out perspective as well.
Absolutely. So in our consultations, we kind of look at all the different elements of skin health. And that includes diet, that includes sleep, that includes exercise, stress, all these different elements, as well as nutrition. So nutrition is key, the nutrition that you get from food. That is paramount. And then second to that would be supplementation, because often I find that our diets tend to be, even when we have a healthy diet, we have about 3 or 4 foods that we love, and those are the only foods that you tend to eat. And even if it's the most healthy diet, all of us tend to go into the same patterns.
There's always one food type, one food group that unhinges us. I know what mine is.
So IV infusions for me are supportive. They're not there to replace food. They're not there to cure any kind of conditions. They're there to support overall wellness. So we have a number of different IV infusions that can be helpful, that have things like vitamin C and B12 in it, that can help boost your overall immune system and overall skin health.
And I think, you get sort of your skin health under good control, and you do sort of feel healthier as a result, and you look healthier, certainly. I want to finish up by just sort of going back to the injectables, how we started talking, because I think it's really interesting what you said. You're not somebody who does use injectables to augment or change or sort of noticeably alter someone's appearance, but I feel like more and more frequently we're talking about their use for skin condition. And I mean, is that something you're seeing? Do you have products that you're sort of really relying upon now?
Yeah, so lots, like Profilo is wonderful. Profilo is a great, it's not a filler, it's a hydrating hyaluronic acid, like an internal moisturizer. But even the fillers that we have, before we used to think that fillers were just there to enhance the scalp, to plump. And they do a great job at that, by the way. But also, they are hyaluronic acid. So when you inject them into the skin, they still pull moisture to the skin. So we now know, not just from my personal experience, but also from studies done by plastic surgeons who've done tissue and reviewed that tissue, what happens to that tissue after it's been injected with hyaluronic acid.
What does happen to it?
It is plumper, it is more hydrated, and it is, so some people always worry, if I have these injectables once, will it damage my skin? If I do it once and never do it again, will it leave my skin in a worse place than where it found
That's what everybody always wants to know. Is it actually going to take me to a worse place?
So now we know that's not the case when it's practiced appropriately. You've seen those ladies that have very, very, very enormous breast augmentation. That is not the normal practice in breast surgery. Same with injectables. There are some extremes, but this is not the way the majority of people practice. When practiced appropriately, it leaves the skin in a better position because it's more hydrated, we've stimulated collagen, and that continues over time.
And even things like Botox. I mean, I'm seeing more and more devices where people are sort of mixing Botox in with other actives and minerals and vitamins, and they're saying, it tightens the pores and it smooths the surface of the skin. I mean, that's really clever.
Yeah, it's a wonderful treatment. Aquagold is a great treatment for that.
Is that one that you have as well? Is that the little golden micro-needling device?
So it's a little canister, and then it has hollow needles, 24 karat gold hollow needles, and it's 24 karat gold just because it's hypoallergenic. It's not just trying to be fancy.
Makes it really expensive. No, I don't don't think it does.
No, it doesn't. So it's hypoallergenic. That's why it's 24 karat gold. Now, inside, you can create a bespoke cocktail of whatever your skin needs. That could be hyaluronic acid. If you add a bit of Botox to it, then what it does is it shrinks the appearance of the pores. So the pores appear fine. Also, a bit of redness as well. It reduces the appearance of visible redness in the skin.
Yeah, I heard that Botox sort of constricts the capillaries or something. So
yeah.
actually, it does reduce the flushing.
Yeah,
That's so clever.
So you can mix different things. Vitamin C, loads of different options in there, and they each have direct impact on the skin.
Amazing. Well, as soon as I'm able to come back and have all these treatments, it's definitely what I want to come and have with you.
Need nothing.
Invisible
Flawless.
pores and no redness. That sounds like my game. Thank you, Ifeoma. It was super interesting, as always. Dr. Sabrina, you're our next lovely candidate. Thank you so much for joining us. I think Sabrina introduced herself beautifully earlier, but she's an ophthalmologist, oculoplastic surgeon specializing in the eyes, as the name suggests. Non-surgical and surgical, I think you said, didn't you? I mean, when it comes to the eyes, Sabrina, what are the skin-related changes that your patients sort of are mainly complaining about, would you say?
So the first thing is that the eyelid skin is the thinnest skin of the human body. Upper eyelid thinner than the lower eyelid. And so regardless of your gender, and I'm really delighted, first of all, to see so many men today, which is a big shout out, man. It's incredible because normally it's only women. So regardless of your gender or your ethnicity, you are going to get dark circles. You are going to get eye bags. And that's the reality of every human face as it ages. Now, certain ethnicities are more prone to it. So in fact, children, and particularly my ethnicity, I'm Indian, I see it in my children and I see it in my nephews and my nieces. They have under eye dark circles. And some children, you see them, by the age of 2, they have under eye dark circles. But equally, there are Caucasian patients I see who have eye bags. So, these are structural changes that are occurring quite young. Some of them are genetically absolutely normal for that ethnicity. And some of them are actually just related to their veins and how their veins are draining and the bony anatomy that is underdeveloped. So we can see these so-called aging changes occur very, very early. And, often I see such young patients in my clinic who are devastated because they're like, am I too early to be having surgery? Or am I too early to be looking like this? But they just have a structural issue. Their bony anatomy isn't developed. And then they have the genetic predisposition to either having eye bags, thank you, mommy, daddy, or, malar bags, which are like little fluid pouches, which you can see too. So because of the inherent nature of the eyelid skin, you can see these changes and you see dark circles. And typically, when you look at the scientific literature around it, you see it around puberty. So regardless, again, of your ethnicity and your gender, a lot of people will start getting thinning under eye skin and a leakage of the blood vessels. And then they start getting changes in the skin. And typically it's a brown color for somebody of my skin type. But in fact, for Ifeoma's skin type, they would have a vascular element to it too. So there's, you really need to understand what's going on. And in clinic, I use special cameras. They're called megzameter cameras, but essentially we put them on the skin and it tells us what's going on, with the skin so that we can identify the type of hyperpigmentation, whether it's brown, whether it's pink, whether it's post-inflammatory, and then we can target the topicals for that. And because that skin is not supported and it loses volume, the blood vessels leak even more. So this is where a whole plethora of treatments start becoming really fascinating. And, I know there are people who don't want to have fillers. When you're young and your tissues are taut or tight, fillers are a really great option. But for those of you who don't want filler, PRP, nanofat, mesotherapy, all these are great treatments to actually support the under eye skin metabolism, because this is a metabolically challenged area. It's just not able to pump out fluid. It's not able, to clear the fluid because it's a closed chamber. So it is an area that ages very quickly. And also it's very low in sebaceous glands. So it's a dry, dehydrated area. And then, long hours on the computer.
That was the other thing I was going to ask you, because it sounds like, with the eyes, a lot is influenced by genetics, but also probably lifestyle changes.
Huge lifestyle changes.
I always feel like whenever I'm just staring at my laptop and I'm forgetting to blink and I come away and my eyes are so dry, and I just think this is aging them as
Yeah.
I'm typing.
Yeah, because what happens is when you are on the computer, you're exposed to high energy visible light, any of your mobile devices. When you're sitting at a window, and till today, I have a patient who'll come in and I say, do you use SPF? And they say, only when it's sunny. Even now.
I hear it all the
wear
time.
All the time. So you have to wear SPF 24/7, especially under your eye. It's an area that's commonly missed. And unfortunately for the darker skin types, we don't have great SPFs because they just sit like white residue under the eye. So, that causes a barrier to its use. People use it with makeup. They think that they're having adequate with makeup. It's difficult to top it up. So I always tell people, I tell my patients, UVA and B, proper UVA and B protective glasses, wide-brimmed hat. Carry your SPF with you. You get great SPFs for all skin types, minimum 30, and you want to top it up and apply it frequently. Again, be careful with the type of makeup you're using, because I see a lot of post-inflammatory hyperpigmentation
Just because
causing
people
dark.
are using the wrong types of makeup, or the way they're applying it or taking it off?
Both. So there are chemicals in the makeup that can cause post-inflammatory hyperpigmentation. So it's not just, it's not just the treatments or the sun that can cause it, but it's actually what you're applying, even in terms of makeup, the friction, the wipes. All these things can cause problems.
And are there any, actually very quickly, we were just talking about SPF for under the eyes. Is it important to use an eye specific SPF? Because there are quite a few of those on the market, or is it more important that it's just a high factor and it goes right the way up to your lash line?
Okay, so it shouldn't go up to the lash line, because the problem is if you use an SPF, particularly physical and chemical SPFs, both of them, if they reach your waterline, it stings and it smarts your eye and you water. So essentially you need to pat it on your orbital bone, and that's how you put an eye serum too. And because of the movement and that constant blinking action, the serum actually gently works its way up to your lash line, but you don't want it inside the waterline.
That makes such sense, because I feel like I always apply it under my eyes, and yet somehow halfway through the day it's in them and stinging like hell.
Exactly. So you don't want to apply it to your lash line. And also you need to be very careful with what you're applying on your lower lid as opposed to your upper lid. And that's why we always say you take a little amount, pat it here, and then whatever the residue is, put on your upper lid. You don't actually want to put the same dollop on the upper lid, because the upper lid skin is so thin that it's even more sensitive. And once you get sensitivity on the eyelid skin, you get eczema, that's it. Then you're actually, sadly, most general practitioners give you steroid ointment, which is going to thin your skin even more. So you're sort of a little chicken and egg kind of thing. And then we have other big guns that we can use, like tacrolimus, and these are things that you come to the hospital and we assess you and we give it to you. Unfortunately, when you're working that close to the eye, if it goes into your waterline, so it's going to irritate you. So the best thing is be really careful about everything you're putting on. Buy good products. Don't use it that close to the lash line, and
give your eyes a rest from the laptop every once in a while. Don't forget to blink. It's my takeaway.
Exactly.
And you were talking about the things that affect us from quite a young age when it comes to eyes. And I think it's so interesting, because eyes are often one of the first areas that we all start to notice little sort of creeping signs, sort of edging their way in, or the fine lines and the sort of pigmentation and whatnot. But what about things like puffiness? Because that's certainly something that a lot of people sort of complain at from a very, very young age. What causes the puffiness?
So sometimes it's just genetic. So essentially the puffiness is your bag. It's called orbital fat. It sits within your eye socket or your bony socket rim, which is like a little cave. And then it suddenly puffs up. And sometimes, interestingly, it could be diet related. So people who just have dairy, gluten, and they can suddenly puff up. Sometimes it's just because you have allergies. So you could have sinusitis, you could just have hay fever, and your blood vessels dilate, and you can
I
get
noticed that
puffiness.
actually. One doctor recommended I take antihistamines for my under eye puffiness, and it really did help.
Yes,
Just once a day.
Definitely.
So
and,
easy.
and try the dietary exclusion thing. You'll be surprised how many people I hear who sort of go, lactose free or dairy free and gluten free, and they notice that their under eye looks healthier, good sleep. is going to help with the puffiness. And then certainly the caffeine-based creams, the caffeine-based topical serums, not heavy creams, but the serums, they're more lightweight, and the caffeine causes the vasoconstriction, which really goes a long way, particularly if you have sinus problems or allergies.
And definitely the way that you apply it, I sort of imagine as well, sort of very lightly under the eye. I always want to sort of be very vigorous with it to try and eliminate all puffiness, but I think that sort of has the adverse effect.
So, through my career as an oculoplastic surgeon and ophthalmologist, I noticed that there were barriers, and there are barriers to how you apply or how you educate your patients, because it's all a lovely marketing spiel. And so, when I decided I was going to do something for the under eye, I thought, right, what is the biggest barrier my patients tell me to understanding how to apply, understanding how much to apply? And so my serum has a fantastic cooling roller ball, which they can also use as a massage. But then it's a lightweight serum that they can apply. And it's very, very high in actives. I can't tell you what the actives are. One of them, Ifeoma talked about. So, it was great. But essentially, because it's patent pending, so I can't discuss the ingredients. But the other thing is, most of the eye serums that you get on the market have 1, 2, maybe 3 ingredients, because most people are worried that if they have too many actives on the eyelid skin, because it's so thin and it's so sensitive, they could have an allergic reaction. So I was, very mindful of, when we did do the research on it in the lab, we actually have 8 actives in it. But we had to spend a long time testing it on different skin types, and my primary target was people of color or skin of color, because I didn't want them to have an allergic reaction. So we have an ingredient there that downregulates inflammation.
And when are you looking to launch this eye serum?
Well, we should have launched it, but my pens are lying somewhere on the high seas thanks to the pandemic. But hopefully by summer.
We were hoping to have a sample for everyone here tonight, but actually, if you'd like to leave your email address on the referral cards and sort of note that you'd like to try Sabrina's serum, then we'll definitely get one of those out to you as soon as they come from whatever ocean they're stuck on.
Yeah.
And what about the in-clinic treatments that can sort of help to take down puffiness?
So again, if it's mild puffiness and it's just a prolapsed eye bag and there's a deep under eye hollow, then fillers are fantastic. It's a great quick fix with really good longevity. And again, if they're performed well and you've assessed the patient and you perform them well, then the complication rate is really negligible. It's very low risk with a very high patient satisfaction.
And you have a very nice technique, your sort of micro droplet technique when it comes to the sort of filler and the way that you dispense it, which is completely quite reassuring. Only so tiny amounts.
It's a biplanar technique, and then micro droplets, very tiny amounts to hydrate that area. The other really interesting thing is skin and tightening skin, because the under eyelid skin tends to get wrinkled. So whilst my skin type will get hyperpigmented, the Caucasian skin type is more prone to wrinkling. And unfortunately, anything that's wrinkled doesn't reflect the light uniformly. So having those sort of lax, lined, wrinkly under eye skin actually makes you look like you have under eye dark circles. So if people just invested in maintaining the quality of the skin topically, so you can apply internally, so you look at your diet, manage your stress. I'm a great believer in managing stress. I'm actually 101 years old. But, so because essentially that under eye reflects everything about what's going on inside you and what's going on around you. And so you really want to be very mindful and bring that wellness into your life. And, I'm a great believer in supplementation, nutritional supplementation, and then looking at minimally invasive non-surgical skin tightening treatments even before you go down the surgical, because just I have Tixel, which is not a laser, but it's great for all skin types because we can manage the energy levels, and it's great for the under eye with really, it has no pain.
Is Tixel the one that just uses heat?
Pure natural heat. It's like a hot waffle iron. It's like ironing your under eye skin. And it's amazing because you can titrate it for different skin types. So with the darker skin types, we have to use really low energy, so you need more treatments. But for the Caucasians, we can go really, all guns blazing on it. And they have a little downtime, but they recover. And essentially, once that skin becomes tighter, sometimes patients don't even need filler, because once the skin is tighter, the skin is plumper, it's hydrated, and it's pulled back, it's reflecting light more evenly. And
that's exactly what Ifeoma was saying as well. You know, you get the skin into good condition, and actually a lot of these treatments, even though we're sat here talking about them, aren't really that necessary.
Exactly.
Sorry, I'm talking you both out of jobs here. But I had an amazing treatment with you as well before my wedding, the Morpheus 8, which is sort of micro needling, but with radio frequency channeling through the needles. Yeah. And that was amazing for sort of really taking down the puffiness. And I don't know what it does exactly.
So essentially, it's got these little micro-insulated needles which deliver, so it's micro-needling on steroids, I like saying, because it actually delivers the energy at different depths. And as Ifeoma said, you know, the fibroblasts, which are your cells that produce collagen. Collagen is the structural protein of your skin. It gives your skin firmness. And then elastin is its weaker cousin, which gives your skin elasticity or resilience. And when you do the energy, when you release the energy to the dermis, you're actually causing a little bit of shrinkage, you're causing microtrauma, and that microtrauma starts the wound healing cascade, which is production of collagen, and then with it, its cousin, elastin. So you get a gradual tightening of the skin, it improves pores, and you get a little lifting effect. And it's
not too painful either. I mean, I was sort of numbed up quite significantly with all the cream in the world, but actually it's very tolerable.
It's very tolerable. Your pain threshold is better than mine. I have lots of Morpheus, but I have it on my face, but it is a little painful, but the numbing does help. And it's a great treatment. It takes about 30 minutes to do, and the negligible downtime.
And I'd actually say the downtime that I had from the Morpheus 8 is even less than when I've just had plain old bog standard microneedling, which has left me red for days.
Okay.
And actually that was probably red for an hour or so.
And do you know why? Because we give you growth factor topicals.
Yes, you have a clever serum that you use afterwards.
Yeah, so and I'm again great believer in before and after care of the skin. Because when you injure the skin, your skin is going to get inflamed. And, my skin may not get as inflamed as somebody else's skin. And so we really need to downregulate the inflammatory cascade. And so I use a lot of growth factor-based serums, which are amazing. They also reduce pigment. So they improve the quality of the skin, but they really downregulate the redness and the bumps that you get from these.
I think anything you can do to sort of downplay the trauma and accelerate the healing, because it's one of our biggest barriers to doing any of these treatments, isn't it? Will I bruise? How long will it take to recover? How long will there be redness? Can I go into work the next day? So it's amazing to be able to do this. I also wanted to ask you on that note, so obviously you do some immaculate sort of upper and lower lid surgeries as well. Do you have the same sort of approach to preparing the skin for a surgery and helping it heal afterwards?
Completely. So we have a nutraceutical drink along with arnica, bromelain, all these things, like you can eat fresh pineapple every day, and you can have arnica tablets, but there's this whole cocktail which is again used by a lot of plastic surgeons, and you start it a couple of weeks before surgery and then you carry it on after surgery, and it just reduces downtime, improves wound healing, because it's supporting the skin and your tissues for wound healing. And then more recently, I've introduced this amazing, it's so cheap, it's £18.99. It's called Solution for Scars. Solutions for Scars, and it's been developed by a professor in Manchester, and the evidence is so strong on it. They've published on it, and you use it for a week before surgery, and then you have the surgery, and then you use it once the wound has started healing, or we've taken the stitches off, which is generally between 7 days and 10 days. And it really improves the redness, the scarring, it flattens the scar, it's a more pliable scar.
I think they say as well that it even switches off the sort of, the itching or
yes,
the
it's
mechanism
a mast
that causes,
Yeah, so you get that outpouring of histamine every time your tissues are injured, so that's what it does. And, I've met the professor, we've shared stage time together, and I heard him present many years ago, and then it's come to market now. So it's really fantastic. I love the science. I'm very scientifically driven, and I may bore you with a bit of my science, but I that's what fascinates me about applying what is happening in the lab to what we're doing. Yep.
And the science is so important. And sort of just finishing up on that sort of surgical sort of element as well, at what stage does a patient who's suffering from the hollowness or the puffiness or the lines and the wrinkles, at what stage do they start to seriously consider going down your sort of surgical route with the blepharoplasties?
So, mild conditions, you can have filler. Mild to moderate, you have to talk to the patient and tell them, look, what would you like? You can go down the surgical route, and you can or you can mix it up. But certainly anything that's moderate and severe, you're getting that end of the spectrum, and that typically would mean people who are much older, who have loose tissue, who have large bags. These are your surgical candidates. That's for eye bags. For upper lid blepharoplasty, the minute you've got more than 5 millimeters of excess skin, so we need about 20 millimeters of skin from your eyelash to the base of your eyebrow hair. Not your plucked eyebrow, but where your eyebrow should be. And if you have any more than that 20 millimeters and it's starting to fold and hang, then you can have a blepharoplasty. But it has to be a significant amount. It has to be more than 5 to 8 millimeters for you to have that surgery.
And I guess as well, it comes down to, no matter what age somebody's having these surgical procedures, that maybe they're just looking for something with a bit more longevity as well. Because a lot of what you do, I suppose, with the injectables will last for 12, 18 months, maybe a bit more, but then it's maintenance, isn't it?
It is. The under eye filler unusually can last years, because the under eye area the eye area is a closed compartment, and some people just don't have the dissolving enzyme called hyaluronidase, or they don't have it in the degree or the level that's required to dissolve the under eye filler. So under eye filler surprisingly can last very long, a couple of years, whereas filler anywhere else seems to break down much faster. So
you were even saying to me before this, sometimes you go to operate on people and open them up and you can still find all the filler in there, which it goes to show that you're right in what you're saying. That was really interesting. Thank you so much, Sabrina.
Thanks.
Learned a lot from you just there. Third and final speaker, Sarah Chapman. Thank you so much for being with us, Sarah.
Thank you.
I think you all know her. I mean, she's sort of cult facialist, one of my favourite facialists in London, probably the first, I shouldn't say that, and has the most amazing line of Skinesis skincare. So, no, real pleasure to have you here. I mean, Sarah, skin is the foundation of everything that you do, obviously, with your brand, but how did you find your way into that world and sort of, carve out this amazing career just helping people optimise their faces and their skin?
I think I've always had an interest in beauty. I've always had an interest in everything to do with beauty. So literally as a child or a teenager. And my mum always tells me actually that I used to mix up products. I used to buy beeswax and oils and different things and put them in a bain-marie and mix them up. And then, of course, she was always the guinea pig.
You must have made such a mess of your
face.
kitchen.
Yeah, it was probably bad. So I always had a real interest. And actually, my career started, I left school and I trained as a makeup artist. That was the first thing that I did. And training as a makeup artist in those times, you used a lot of very heavy makeup. And we would spend a long time just correcting the skin to get that to look right before doing any kind of fashion.
So you could actually see the effect that all these sort of makeup products were having on the skin and sort of causing the breakouts.
And blemishes and breakouts, and young models that we were doing sort of makeup on, really thinking, well, why do we have to spend an hour and a half actually to get their skin to look flawless? What is really going on in the skin? And what's kind of beneath that, and how do we actually work with that? And that was really what triggered me to go much more into the sort of beauty side from makeup. So then I actually went through a whole series of different things, because my fascination with beauty, with skin, with everything. So I trained as an aromatherapist. I studied in that nutrition, kinesiology, massage, so a real broad range. I even did hairdressing at one point. So somehow thought that would be relevant to what I was doing.
I can see how the aromatherapy and the kinesiology works its way into the treatments you offer, because I've laid on the treatment bed with you, but not the hairdressing.
Not the hairdressing, no. But yeah, it's really interesting, because I think that all of that sort of initial grounding, and then actually later in my career I studied cosmetic science, so really looking at formulations and how formulations are basically built. How are they put together? What do you need? What's possible? What's the norm, but what actually could be done if you wanted to kind of break the boundaries a little bit and do it differently. And I think a lot of my sort of understanding of skin has come from that sort of early hands-on, quite holistic view of skin, but then the science part of it, by being so fascinated with product and doing cosmetic science and bringing that whole sort of piece together, is really what we do in the treatment room, but also with all the products that people can use at home.
And it's so rare to find a brand that does that to such a high degree as well, you know, really fusing the sort of holistic elements with the science, exactly as you said. I mean, from your perspective as a facialist, you see so many faces and complexions sort of laid out on a table in front of you. Do you think that our skin does influence how we feel on the day-to-day, self-esteem wise?
100%. Absolutely. I mean, you hear a lot of people who say how much it affects their confidence if they have skin that's troubled, if they've got acne, if they've got even one spot and they're not used to having a problem with their skin. It really affects people's confidence. And I think actually this last couple of years and the pandemic and that increased kind of anxiety that's kind of been generated in people, and you were talking about, you know, Zoom calls and how often do we normally look at our skin and our faces in the mirror? It's like a quick look, and actually we look at ourselves quite nicely. We sort of look up, we hold our chin up.
We all do our mirror face as well.
Yeah, exactly. It's like a phone voice.
We look from the right angles. Yeah. Zoom doesn't get those angles.
Zoom doesn't do that. So I think that has given a lot of people a sort of a new skin paranoia. People are looking at everything from the tiniest of milia and pores, but also very much about slackening and just the shape of the face, because you're looking at it from a different angle. And I think there's been a real sort of change in that, and I think it's been an interesting time, and what we're hearing people saying is different.
Yeah. And are you seeing patients come or clients come in actually seeking different things from their facials as a result? I mean, wanting, I suppose, to address things that they'd never seen before, or feeling like they need more healing? I don't know.
Yeah, kind of mixture actually. When people came back from the whole sort of lockdown, when we reopened again and were doing treatments, clients that we've seen for years and we might see every 3 or 4 weeks and we know them really well, came in and said, right, I've got my 90 minutes. I want everything you do, and then I want bells and whistles on top. What can you do? And we have, in addition to sort of our hands and all the techniques that we do, we have a lot of the technologies that you've spoken about as well, with Morpheus 8 and our therapy and all our IPLs and lasers and microneedling and radio frequency. So we've been able to kind of take their skin that notch up, and people want almost a really quick fix now. It's 2 years of barely having their treatments for people who for years have done them every 3 to 4 weeks. So they want to see a result because of this new sort of skin anxiety, but they also want it fast, and they want something that's kind of more. But then the other part of it is the hands-on. You know, we sort of lived in a time where there was no contact. We were very distanced from people, and I think that we can't underestimate the sort of power of touch and that 100%. Healing part. Yeah. And that's a huge part of a facial. It's a huge part of what we do. So we might have technologies, but we're really touching. I mean, when people came back, we had people burst into tears in the treatment room just because they suddenly felt sort of comforted and touched and sort of loved again in some sort of way. I think it's
one of the senses that we all completely took for granted, in a sense. You know, people would say, you know, which sense would you sort of lose first? And actually most people probably were like, well, touch, I don't want to not see, I don't want to not smell or taste things. But actually I think COVID, you're right, sort of isolation periods really gave us a huge appreciation of how important it is to have that tactile sort of sensation.
I think so. And I think so much of everything to do with beauty is actually that combination of everything. You know, we sort of throw the word skincare around as a kind of terminology, skincare because it's a product, but it's actually skin care. And there is a care element to it. And I think that people sometimes forget that. And I think that the care part of it is really important.
And it can so often be seen as sort of like fluffy or irrelevant, particularly when you're sort of going in for a facial. But I think obviously the treatments that you've sort of curated and cultivated go so much further than like a cleanse, a tone and a moisturize. You know, people are really benefiting on a psychological level from them. Also, you know, they're getting results. And I think people sort of see these facials now as a necessary part of their maintenance regime, don't they?
Yeah, and I think people who maybe before did it as more of a treat, as more of a luxury, or did it occasionally, now it has become a necessity. And there are lots of clients that we have that have always seen it as a necessity, But now it's sort of even more so, and actually it opens up the conversation to injectables, it opens up the conversation to surgeries, to all the different kind of technology treatments that perhaps weren't there with everybody before, but actually there's many more people that are interested in that. And I don't know also if it's because people had time to research that during sort of lockdown. People had a lot more time on social media or on Google looking at things that they hadn't perhaps done before. And then with that sort of increase looking at your skin, we have a lot of people who said, I didn't realize there were so many things that I could do without maybe going into the surgical route or even going into the injectable route, because there is so much that you can do with the devices that can get you such incredible results. And I'm a big believer, and actually you've been talking about it as well, in that the skin has got to be good and the skin has got to be healthy when you start doing technologies and when you start doing injections.
So true. Everyone says this, otherwise you're barely scratching the surface.
Yes.
And you can spend so much money and so much time on these treatments, and actually if your skin isn't optimized, then you're really wasting it. You're throwing it away.
And I think that's also when you get the balance off. You start to look like somebody who's done lots of filler or injections because you actually haven't got a good skin that's holding it. And we see that, we're looking at faces directly in front of us, and you can see where somebody has just gone down that route and never really looked after their skin, that it doesn't look harmonious with the face. So it's really important to blend everything together. Everything has its place. And I think now there's also this very much philosophy of a sort of smattering of everything, a little bit of everything, and do it often, and it can look really natural and really fantastic.
Everything in balance, as they say. And I feel like you just touched on this as well, but I feel like there's a real movement towards this sort of healthy looking skin, like glowing skin. Like why is that? I mean, because I think we are definitely moving away from we just want to chase all the lines and wrinkles away and actually just have healthy, radiant skin now.
Yeah, I think, and that glowing skin, people want to glow. People always say, I'm kind of tired of looking tired. I don't want to look tired anymore. I want to look fresh. And I do think that the pandemic and that increased awareness of your own health, it has been a real shift, because I think glowing skin is almost like a barometer of internal health. And I think if you look at somebody who's radiant and glowing, you naturally think they're well and they're healthy. And I think that that's what people want now. They want to look like they're very well. They look like they care for themselves. And actually that comes with that sort of glowing complexion.
And the psychological connotations as well, it's about fertility, it's about youth, it's about all these things that actually glowing skin makes us appear at the end of the day, isn't it?
I think so. And I think, if you see somebody who's glowing and radiant, you think they're happy. They might not be, but actually when you're happy and you show that and your skin is glowing and radiant, it makes you feel better as well. So it's not only other people's perception of you, it's actually how you then feel, and then you behave in a different sort of way to people, and that strikes up a whole thing, doesn't it?
It's what you project to the rest of the world. It's so true. You touched on your sort of products, and you've got some amazing tools in the range as well, but what's the whole philosophy behind those? Are you influenced very much by the skin that you see on the treatment table in front of you, or is it a case of like what's new and exciting and like some cool, exciting ingredient that you've discovered, for example?
It's a mixture, actually. First and foremost, it's skin that we're looking at in front of us. So I have a very much a sort of face to formula approach. What do I see? What are the changes in people's skin? What's happening with skin conditions? Over the years, those change due to environment, due to stress, due to what people are doing to their skin. So very much that is what creates the thinking for me for new products. But the science enables the innovation. So always looking at the research, always looking at ingredients. The things that we're looking at and reading about all the time on raw ingredients and new things that can be put into products and the research that's done on those, we'll be looking at sort of 3-4 years before it ever hits the market. So we're working on formulas now that maybe people won't see until another 2 or 3 years' time.
God, that's so
and
exciting.
That's really exciting.
I'm desperate to know what those are.
Yeah, that's very exciting. Well, it takes such a long time for me to develop a product because I'm very particular about what I do. And I have a brilliant team that work with me now, and they've got something, then we've worked on it for ages, and they say, this is great now, it's fantastic, it's ready. And I say, it's not quite there yet. We've got to have a little bit of magic in everything, but also everything for me has to perform. The most important thing is that it has to give results for the skin. So my products use a lot of vitamin A, vitamin C, all your antioxidants, hyaluronic acid, the ingredients that you've been talking about, because those are the things that we know make a big difference to the skin. But the beauty is that you actually get them in a formula that feels good, smells good, and
That's
gives
what I was
you the
about to
pleasure.
say. They do deliver on every level. I mean, the scent of your products is just so transporting. I love them.
And that was the key part of it, because, you know, beauty should be a pleasure, not a chore. It shouldn't be, oh, I have to cleanse my face at the end of the day and it's really boring. It should be, oh, I really enjoyed that and that made me feel really nice and now I'm sort of ready to go to bed. And that's what we hear from people who've cleansed with the cleanser. So it's about delivering science, it's about giving results, but it's done in a pleasurable way. For me, one of the things I always say is cosmeceuticals can be beautiful. It doesn't have to be a sticky, horrible cream in horrible packaging. It just doesn't have to be
so
that
true.
way.
I think for a long time that's what a lot of cosmeceuticals were like, and we all ran a mile from them, but I think your brand has definitely sort of broken boundaries with that. And I think your devices as well, you have some very cool like tools like facial rollers and like steamers and like pore extract. I mean, it's really clever because actually with all of your products in your bathroom at home, I mean, you frankly don't, I mean, it's always nicer obviously going to you for a facial, but you can very easily sort of recreate that at home, can't you?
Yeah, and I think that's a really interesting point actually, because part of it is also bringing the treatment room to people at home, because not everybody can go for a facial or is in a location that can get to us for a facial. And actually that was a really important part of lockdown and COVID and that whole time. So people contacting us constantly saying, I bought your steamer and honestly it's saving me because every day I do it, and not only am I seeing my skin looking better, but I feel better because it again brought a little bit of that self-care and TLC back. So in terms of well-being and how people feel. So yeah, we have the steamer, we have a pore extractor, which will help to get
That's
rid of
amazing.
all
It sort of
that.
vibrates slightly, is that right?
Yeah.
To sort of dislodge anything that's in there. I mean, I need to get my hands on one of those.
It
It sounds
does.
so good.
But it's interesting because it is very much that kind of, what are we doing in the treatment room and how do we then encapsulate that for somebody to use at home? So there are pore suction devices. But when we're going to do extraction in a clinic, we warm the skin with steam, we massage with oils, we then use a manipulation technique with our fingertips to loosen it. So the device actually has a thermoplate that warms it. It uses ultrasonic technology to kind of jiggle it around, and then it does the suction. So it's not
literally
just
your
diving in
fingertips
with
a machine.
Kind of.
So clever.
And the facialist massage are the same. In the treatment, we do quite a sort of vigorous massage, you know, from it. And it's a really interesting, fast massage. And clients always used to say, I try and do a bit of it at home, but it never quite feels the same. So we developed a device, which was years ago, which is like a roller that kind of knuckles and kneads into the skin.
Oh, it's so good. I mean, you need a little bit of slip, like some sort of serum or oil on your face beforehand. Otherwise, it's sort of quite vigorous. But no, it's an amazing technique.
Yeah, and it is good to be able to add those elements into people's routines at home from so many different perspectives, psychologically, for the well-being, but also to really sort of ramp up their home care routine, because I think it is really important that actually it's what people do at home that's almost more important than what you do in clinic, because you do that once a month. But at home, every day they're doing something. So if you want to have amazing skin, you've got to do the homework.
I feel like it's something that probably all three of you would agree on, right? Like you have to do your homework in between. Sarah and I, you had this conversation. I was like, it's like going to the dentist, but never brushing your teeth at home.
Exactly.
Like, why would you you have to do your homework, exactly as you said. Tell us a little bit about your medical wing, because that's something new that you launched, which is really exciting. You've got a resident dermatologist there now and really cool stuff going on.
Yeah, we have. And I always wanted to have a sort of medical space within the clinic. It's taken us a long time to get there, but we have. And it's we have Dr. Alexis Granite, who's our consultant dermatologist. And what's brilliant for us is we're dealing with skin every single day, but there are things that we can't treat because we're not doctors, we're not medical. And if somebody has acne that needs prescriptive treatment or rosacea or something on their skin that they are concerned about, we're able to then introduce them to Alexis, and then they can have that dealt with in whatever sort of way. And then on top of that, obviously, it brings in the injectables, which most of our clients always used to say to me, can't you just do everything here because I trust you? And then whatever's done here, I feel
get
safe.
so comfortable and and safe when we know the place and the practitioner.
And so we have the ability now to do the sort of the next level of technologies, the injectables. But for me, the very exciting part is to have that real clinical dermatology piece as well to work alongside the treatment. So
she does all the mole mapping as well, Alexis, doesn't she? Which is brilliant. You know, if you've got a suspicious mole, or, you know, you just really want to have that peace of mind. Because I think it's not just about looking at our skin health today. It's thinking, how is this going to develop over the years to come?
Yeah, and the beauty of the mole mapping is every year you can have the full sort of camera assessment, and then it's logged, and then next year you have a look, and has something changed, and that highlights to take a proper look at it. So it's a preventative, and it's a sort of insurance really for your body from that perspective.
And it just ensures you don't miss anything as well. I mean, I have hundreds of moles, and in fact Alexis did a mole check on me years ago with the mole mapping at the Complexion clinic before she came to work with you, and it's amazing to have those photos, exactly as you say, and always have a point of reference, and not think, is that new, is that not new, I don't know, is it dodgy, should it be removed?
So even people who don't have something that they're worried about will just do it anyway, so that it is something that's logged that you can then monitor as you sort of go forward. And I think that's a really great thing. So that does bring in the real skin health and preventative element alongside the much more aesthetic piece as well.
And also, I just want to finish on talking about your face massage, because you spoke about it and we didn't really discuss it enough, but it's one of the most standout things of your entire treatment, because it sort of sculpts and it drains and it energizes, and it's just amazing. Are there any sort of tips that you can give us so that we can go home and do something sort of similar in our bathrooms tonight, ideally?
Yeah, we do a lot of massage, and it's quite interesting technique, so much so that after the massage, quite often people say, what was that machine you were using? And it's our fingers, but we train them to go very fast.
Super fast. I mean, they must be exhausted at the end of those treatments, I always think.
Sometimes. We do about 4 different techniques within it. So we do a really sort of vigorous gymnastics massage, which really brings the blood flow. It's fast, it's sort of furious, it's pumping the cells with oxygen and nutrients, and it really gets everything going. And then we do lymphatic drainage, which is much more slow, and it's removing the fluid and the toxins. And we do like a dry lifting massage, which is working with the muscles, and then a deep sort of muscle massage. So all of that combines into what I always say, it's like a sort of symphony of music. It starts off slowly and it's all very gentle, and there's this massive crescendo, and then it sort of comes back down again as everything sort of calms.
It's the one point in a facial where I actually stop talking.
Yeah, exactly.
I just need to enjoy this half an hour now.
And it's quite meditative, because there's almost a beat. So actually, when we used to train people, we had one of those piano things that. So you start counting, and people go to bed when we're training them, and they're counting 1, 2, 3, 4. So it almost does that to your mind as well. So when we're doing something that's really kind of energetic, you're actually lulled into this sort of sense of relaxation because of the sort of meditative count. But there's lots of things you can do at home. And it's good to do massage with products, so you can do with like an oil-based cleanser like Ultimate Cleanse.
Is that the one? No, in fact, it's overnight facial, I think, that's in our goodie bags for tonight. So is that something that we can use with the Okay, amazing. So we can go home and try this.
Yeah. Overnight facial is actually what we massage in during the treatments. So you have in your gift bags today. So you can do some really fast, sort of vigorous massage. We use the knuckles a lot at home. We sort of teach people to literally, so as if you're drumming your fingers on a table, but you're almost sort of doing that to your face, so that you're really kind of working into the muscles, you're boosting blood flow. We do a lot of pinching. I can't do it holding onto my microphone. We do a lot of tapping. We do pinching. A lot of fast movements. You can do it on my face. Yeah, a lot of lifting. And if you're doing it at home, you can really sort of work into the skin. And I always say, don't be afraid of making your skin pink. That's kind of what we want. We want
because that's all the blood coming back to the surface.
Rushing in. Yeah, if you think about fibroblast cells or whichever cells, the more nutrients and oxygen and everything that goes into them, the more they're going to throw out collagen or perform. Yeah. So in a way that you do with your technologies. But if you can just literally little fine sort of pinchings, that's one movement that anybody can do, and it's really, really easy. And then if you want to do more of a sort of a drainage, if there's puffiness, you can really work out towards your lymph nodes here and your lymph nodes here.
So almost like trying to drain all the fluid there.
Yeah, so you can really do in a much more sort of sweeping and lighter kind of way.
And is that still using your knuckles?
Can use sort of parts of the fingers, or you can even just do with your fingers like that. And around the eyes, you probably do lots of eye massage tips and techniques as well. But little light sort of pumping around the eyes can be really good if you get sort of puffiness. So if I've done a long haul flight and I can see sort of puffiness from the flight, I'll literally just sit for a few minutes and I'll just pump, pump, pump. And you're literally just helping to kickstart all of that drainage back again and then working it around. And it doesn't have to be heavy. Eyes should be treated very delicately, I'm sure.
Because you're using your ring finger there, which I feel like people always say, use the ring finger, it has the least pressure. Is that right?
Because you can't really push hard with your ring finger. And if you just work around and again sort of into here, and then if you wanted to do something that has got a bit more power, you can really work into this point here, which is great if you get headaches or any kind of tension.
Yeah, that's
and
such a nice one.
Can be quite sore.
Yeah.
Thank
It's
you.
so
Thank
good
you. Very good assistant job.
But
Yes, exactly.
But it's also so nice to then encourage people to do that, because then I feel like they really get to know their own faces and their own skin, and then if we sort of feel more comfortable touching our faces, then I guess we have the more confidence to sort of do all these things and maybe see some sort of positive results.
And I think a little bit of massage is so easy to just put into your routine. It doesn't have to be a whole facial at home, but it can be if somebody wants to do that, like people will do a Sunday night bath or whatever, where you can turn it into a whole facial regime and do masks and everything with it, and that can make you feel really good, but it's also really beneficial for the skin. But if you just want to put a few movements in every time you cleanse or when you put your night oil on, then you can do that. And again, it's just that little bit more than just applying your product, helping with the blood flow, helping with drainage, and really improving the health and condition of the skin.
And happiness of it, and happiness of ourselves.
And the joy.
Such a nice evening ritual. I'm going to go home and do that tonight with my overnight facial. Thank you so much, Sarah. That's amazing. Lots of tips to take away from that, I think. I think that's very much the end of our discussion now. We'll move on to some Q&A shortly. But yeah, I just wanted to say a big congratulations and thank you to our beauty triangle. They've been so insightful and fascinating to listen to. And I think, you've all got such similarities in the way that you practice. It is about this inside out sort of holistic approach. And I don't know, really doing the things to safeguard your patient's skin sort of in the long run as well. And I think, there's no doubt about it. We will all have bad skin days at some point. But I think actually knowing the topicals that you mentioned, the treatments that you spoke about, even just the people to go and see is often the first step to feeling like you're back in control of your skin again, isn't it? If anyone does need to scoot off, please don't forget to pick up your goodie bags. They are hopefully somewhere around. Yep, we're pointing there. They're all lined up and ready to go. And do leave your referral cards for us to collect at the end in case you wanted the nice serum from Dr. Sabrina or any just referrals and connections from us. And in the meantime, were there any questions? You can just chuck up your hand if there are. It's the problem with big groups. No one ever wants to ask questions. We have one.
Sabrina was talking about, a few people were talking about the from inside and from outside, collagen supplements.
Always comes up at every single talk. What is the verdict?
Is the collagen, they're quite expensive. Is that kind of, I know they're kind of going to the joints and stuff, but especially sort of after a certain age, is that worthwhile or is that a waste of money? Do you need to put it from the outside or the inside?
Okay, so do you want me to go over that? So essentially, it's not just the hydrolyzed collagen peptide supplements. They have to be a particular milligrams of weight, and between the marine and the bovine collagen, you're looking at a minimum of 3,000, but we tend to bat at around 7,000 to 10,000. But it's not the hydrolyzed collagen peptide alone. So there have been a couple of randomized controlled trials that actually look at the combination of this with vitamin C in a bioabsorbable form, and vitamin B, fish oils, MSM. There are other ingredients that actually count. And so it's actually the nutraceutical, which is why I don't just talk about hydrolyzed collagen peptide. It is actually this nutraceutical combination that reaches your fibroblasts and lay in your fibroblast for 14 days. If you ingest one drink today of that particular type of cocktail with the ingredients at the level they should be with the bioabsorbability, then they will hang around in your fibroblast for 14 days. And so it is it is quite powerful. I do speak not only from the scientific evidence, which we didn't have 4 years ago, we didn't have 5 years ago, but the evidence coming out is really strong. These nutraceuticals also work on hyperpigmentation of the skin, but then you're bringing in other vitamin A, etc., other vitamins in it, and so it's not just the hydrolyzed collagen peptide. It is actually the combination of these other, particularly vitamin C, which is key.
I'm taking the C.
Yeah. I don't know.
Ifeoma, what do you feel?
I think that the evidence is better than it was before.
Yeah.
Before we used to say that if you're taking collagen, your body's just going to break down the collagen.
Yeah.
And into its amino acids and use it however it feels.
Yeah, it's
And
going to go
it's gonna go everywhere.
It might be going in your toenails.
Yeah.
Or something,
Yeah.
you know.
Or you might just weigh it out.
Yeah, it's
It's
out.
the toenails,
And it's
huh?
not a direct, if I take a pound of collagen, is my skin going to increase by a pound? We know that's not the case. But the evidence did start to shift a few years back where we found actually it does help with joints, actually it does help with eyes, and we are seeing that there are some improvement. But as Sabrina said, there are very few collagen supplements that have evidence. So what we know is that there are some published papers that says that those specific collagen supplements have shown some evidence. But I think there are a lot of collagen supplements out there that do nothing. So I think you've got to be quite careful in picking the ones that actually have evidence.
The main kind of one that everyone knows.
I mean, the problem is people think they're going to get face tightening, and it's not. It's hydration. So 3 months of use, and you're looking at about 28% improvement in skin hydration. You're also looking at a reduction in fine lines and wrinkles. So reduction in fine lines and wrinkles, not an erasure of fine lines and wrinkles. But that is after 3 months of use of these particular type of nutraceutical cocktails. So it's not going to suddenly tighten your skin or, work miraculously that way. So I think it's what you're telling your patient. Particularly, I think if you're looking at perimenopausal, postmenopausal women, there's certainly a huge improvement in skin hydration. I mean, I'm postmenopausal. I've never used a retinol on my skin. I don't use a cleanser and a toner. There you go. I put my hands up. Yeah. I use micellar water. I'm blessed genetically. I am blessed genetically. I'll be 55 this year. However, I do stimulate my skin with either Morpheus 8, Ultherapy, ultrasound. I have a very rich antioxidant diet, and I do take nutraceuticals. And, my skin is in better condition now than it was at 40.
And actually, if you started drinking a collagen drink, how would you know if it's the collagen sort of improving it, or whether it's the new growth factor serum you're using, or the new device you just trialed?
So
it's quite difficult to quantify.
It's very difficult to quantify, but in again, these two RCTs, the randomized controlled trials that were done, they specifically found, and they were very clear about the kind of improvement and the percentage improvement in the sample group where people were not doing anything else. So these people were not having any other kind of injury to their skin, or they were not having any other treatments. I think the evidence needs to be stronger. There's no question. However, we do have reasonable body of evidence backing the recommendations, and certainly what the recommendations suggest is when you're having a treatment, particularly if you are in a mature group where your estrogen bus is not working, and you're not able to support the production of collagen, then certainly taking this along with injuring the skin would improve the outcomes that could possibly be achieved.
Did you have anything to add, Sarah?
No, I would agree. I mean, I don't know all the research papers and things, but I'm not quite sure how it's going to go specifically targeted to the skin and make that difference that people are looking for, because I think you're absolutely right. If somebody takes a collagen supplement, they think it's going to boost the collagen out and they're going to have firm, lifted skin, and I don't think that's a possibility.
The body will
Unfortunately,
prioritise many other things before it finally gets to your skin.
If you do, I mean, say it's for 3 months and you achieve like 28% hydration after 3 months, how does that compare, like, kind of cost-wise with Profilo? Or like
Or just using a serum or something.
What kind of percentage improvement would you get?
I don't think Profile. Do you want to go with this?
So I think that now we're getting into like, it's so difficult to say. So if you're eating a supplement, let's go with something that we know. If you're using a medication, let's say a tretinoin, a retinoid, that we know without a shadow of a doubt that is stimulating collagen, and we were to compare that to Profilo, even then it would be so difficult to say, if you use this much tretinoin, which we know stimulates collagen, you're going to get this percentage improvement, which is better than Profilo. With Profilo, what you're really doing there is you're injecting a molecule, hyaluronic acid, that draws 1,000 times its weight in water into the skin. That pulls moisture, and so your skin feels more hydrated, feels more dewy. Conditions like eczema feel more hydrated. That's a very subjective thing. If you take a collagen supplement, you may feel you have more life, you may feel you have more longevity, you may feel more energy, and you may subjectively feel that your skin looks more radiant. Those are such subjective things that you would need to have biopsies, spectrometry to be able to compare head to head. And I think that they do different, you're looking at actually different types of things, not one or the other. I think it's, some people want an injectable moisturizer provider as well. Other people want supplementation.
I mean,
Do any of you actually take collagen supplements, just out of interest?
but I take the nutraceuticals.
The nutraceuticals,
So
yeah.
we have to be
that
very
says a
clear.
lot.
It's not just a hydrolyzed collagen peptide. It's actually the nutraceutical supplement, which is helping your hair, skin, nails, joints, gut health. So, there are huge scientific meetings on anti-aging and the use of nutraceuticals in diet. I mean, I'm going to ask a question. How many of you all drink alcohol in this room? Just put your hands up. Great. How many of you all eat chocolate or eat sugar? Put your hands up. Fab. How many of you all love a sunny holiday? Put your hands up. Great. And how many of you all suffer stress? Okay, you got the 4 S's that cause skin damage. Okay, so your skin, and that's modern lifestyle. So modern lifestyle, stress is shortening your telomeres, your chromosomal telomeres. You're going to have aging, forget the genetics. It's going to change that. Your sun is going to do that. Your stress, and we are all under chronic stress, and we came out of 2 years of a pandemic where everybody drank like there was no tomorrow because they were bored. They baked cakes and ate sugar like there was no tomorrow because they were bored. And guess what? No wonder they see their skin aging in such a horrendous manner, because you are what you eat in the end, and you are what you're putting into your body, and we're doing that day in and day out. So, it's nutrition, antioxidant-rich diet, detoxing your liver and your kidney is going to have a phenomenal effect on your skin, as is gut health. And so there's a lot of research that goes on looking at how hydrolyzed collagen peptides and these nutraceuticals actually work on gut health and how they work on supporting skin. And we hear that in all the advanced anti-aging congresses we go to world over with professors looking at this. So
it's such a can of worms. I feel like the collagen debate. You can sort of go on forever and ever about it. It's so interesting. A lady at the back.
Dr. Sabrina, just curious, you said you don't use retinol. Is that because you're against it, or?
No, it's not. I'm not against it at all. Every time I have, and I've used encapsulated and everything, my skin just reacts horrendously. And I think this is really important because everybody's skin is different. That's why she has more than 50 peels in her skin, because no one of us is the same. I'm blessed genetically that I don't, there are certain things I do that I get away with and my skin doesn't need it. But I do prescribe tretinoin to my patients, and there are skins that need, and there are patients that need retinol under their eyes, so it just depends on your particular type of skin, what your concern is, and then there's no reason why you shouldn't use it.
This lady here, hi.
Why is Profilo a 2-stage procedure?
So for those who don't know, Profilo, you do it on day 1 and then you do it a month later. It's because of the longevity, really. Profilo is wonderful, but it's free hyaluronic acid. That means your body has a natural enzyme called hyaluronidase that breaks it down. So if you just have one Profilo and do it, you'll see a moderate benefit that will last about 2 to 6 weeks max. But when you have 2 treatments, 1 month apart, when they did the studies for it, they found that doing it like that, you had more longevity, lasting more like 3 to to 4 months.
And then you would do a course of Profilo, ideally, would you?
Yeah. Some patients.
That's your initial start, and then you can do it again.
Yeah, some patients required a third dose 2 months after the second one. And it's not dissimilar to mesotherapy where you're using uncross-linked hyaluronic acid. So essentially what we use as fillers, what we inject, and if you've heard of them, the Teoxane or the Allergan portfolio, the Galderma portfolio, Restylane, etc., they are cross-linked, and they're cross-linked to increase their longevity. And so they last much longer and they don't break down. Whereas our body produces uncross-linked hyaluronic acid, which is really very free-moving. It's got very mobile chains, but it breaks down and it's reproduced every 24 hours. And so when you use uncross-linked hyaluronic acid, which is your mesotherapy, or you can have different kind of cross-linkage thermal bonds, which is your Profilo, then it doesn't last as long, but you need to have repeated treatments. And there seems to be an element where you're stimulating the collagen because of that hyaluronic acid that is being given in that particular way, and then it kickstarts.
Is it the same with the Profilo for the body? As in, does the
It should be.
hyaluronic acid last the same amount
Yeah.
of time?
Yeah.
Because the skin cells of the face turn over so quickly, don't they, versus the rest of the body? But it's less about skin cell turnover and just the amount of
Hydration.
Lady here.
Hi, thank you very much, ladies. A really insightful panel. I have 2 questions, hopefully loud. The first one was basically on dark circles, particularly on dark skin tones. What topicals and lasers maybe you recommend? And the second question is, I seem to be getting all my skincare information from TikTok and Instagram.
Join the club.
And there's 2 things I've learned about recently that really blow my mind, and I'd just like to know your opinion. The first one is slugging, which is putting Vaseline or hyping your skin, and I've always been told that you put Vaseline anywhere near your skin. And the second one is dermaplaning, which is like shaving your face. And I'd just love to know your opinion.
Goodness, that's 4 questions by my count, but that's fine. We'll let you get away with it. So the first thing was about dark circles and on pigmented skin. Maybe Ifeoma, you want to start with that, and then Sabrina can talk about the next one.
So whenever I look at hyperpigmentation or dark circles, just as Sabrina says, there are multiple causes. And the first that I always talk about is diet and allergy. So try to figure out the underlying cause. Whenever we're thinking about dark circles, people always want to know what's the solution. But first, you've got to understand the underlying cause. It could be that the bone, that genetically you have deep set eyes, and if that's the case, then there is always going to be an element of a shadow. The next, I look at the vasculature to see, is there, what's going on with the vasculature? Do you naturally the vessels? Yeah, what's happening with the vessels? What's happening with the muscle? Is it the skin? So if you've got thin skin, irrespective of your skin tone, then what you're going to see more of is the muscle. The muscle is brown. So it will give you an illusion of hyperpigmentation, but actually it's thin skin. So the treatment there would be to thicken the skin. If there's no fat, it would be to inject fat or filler into the area. And if there's true hyperpigmentation, so darkening in the actual pigment, then we can do topicals, chemical peel, loads of different treatments to be able to reduce the pigmentation in the area. But first step is to understand what's going on. And one of the biggest ones that's often neglected is allergy. Allergy. So one of the first questions I ask is, are you allergic to dairy? 90% of black women over the age of 60 are allergic to dairy. And this is something that we don't talk about very frequently, and that shows up in the skin in many, many different ways. So trying to understand and recognize what are the symptoms of dairy intolerance, lactose intolerance. Do you get bloating? Do you get irritation? Do you get rashes? Do you get flatulence? All these different things that you think, oh, I thought that was normal, or constipation. And then seeing that turn up on the skin. And in darker skin types, that will be brown. In lighter skin types, that might be red. So understanding what are the drivers to the discoloration and then focusing treatment on them.
Sabrina, what have you got?
I mean, there's a very simple test you can do. You just pull your skin down and you'll be able to see the hyperpigmentation. So one of the ways under eyes age is, again, regardless of your gender and your ethnicity, you're going to age with hyperpigmentation. And skin has 2 layers. You have the epidermis and the dermis. And so epidermal hyperpigmentation is what is very effectively treated by good topical skincare. So it's working on that surface layer. The dermal pigmentation, that means what's deeper, is trickier to treat and takes time. And then we have invasive treatments, and that's where your IPL, your lasers, your Tixil again to deliver drugs transdermally into the dermis or doing deeper peels. That's where it comes in. The issue is, people just want one fix. They want a quick fix, and they don't want to understand that there are different layers there that need to be tackled. And it takes time. And pigment, and I don't think we discussed this, it takes at least 12 weeks, or at least that's your cycle, to start seeing a change, your melanocyte or your pigment cell, before it starts showing a change. It's a 12-week cycle. And so most people just give up and they say, I didn't see any improvement with my cream or my dark circle, blah, 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 because they haven't been educated. They're expecting a quick fix. So, it's understanding all the nuances of it and then sticking to, so treat and protect. That is part and parcel of treating your under eye dark circles and having the patience to get the result.
And chuck all my milk up free.
Not necessarily. Only if you're allergic, not everybody is.
Sarah, what are your thoughts on getting skincare advice from TikTok and slugging and dermaplaning?
There's lots out there, isn't there, that's very confusing and not too sure about. Slugging, the whole Vaseline thing, I've seen that. I don't really understand why you would do that. I think what they're doing is trying to form a seal to push other things into the skin. But you don't need Vaseline to do that. You can use a really good cream to do that, or you can put a serum underneath a mask and use that. So if you've got sort of a sheet mask, a biocellulose, something like that, that's going to adhere to the skin and act like a second skin. So enabling whatever's underneath to go into the skin much more.
So it's more about layering things and just sort of using the right formulations, rather
and
than just slapping Vaseline on top.
Yes, exactly. So thinking about what's your specific concern, what are you trying to do? Is there something with your skin that is a particular concern at the moment? So whether it is a pigmentation issue or whether it's just a dehydration of the time of the year, or what is it that's going on? Choose a serum or a product like a serum that will target specifically that, and then try to get that into the skin. The best ways to get that into the skin are microneedling, because you can open up the channels on the surface of the skin and you can get much more of your product in. And you can do microneedling at home. You can do mild microneedling, so using it as a tool to really get that product in. And using something like a biocellulose sheet mask to really seal that in and kind of close that and get maximum effect in the skin. Dermaplaning. Sorry, what was that? Home care, generally you get, a 0.2?
Yeah, 0.2 to 0.3.
Yeah.
You're not allowed to go deeper than 0.3 for home microneedling.
And is that with one of those little derma rollers, like the spiky wheel that sort of rolls over the skin?
There are different things, aren't there? There are stampers, so you can actually do a sort of stamping technique, or there's rollers with needles, or we do one which actually the needles are made out of crystallized hyaluronic acid. So as you roll everywhere, and then you put a serum on, and then you roll again, and it dissolves the needles through the channels, so you release the hyaluronic and the peptides deeper into the skin. And they're sort of sterile, and it's like one use. You get a kit of them. So there's different ways that you can microneedle at home, but it is a really great technique to sort of ramp up your skincare routine and really specifically target things and make them more powerful.
And what about the dermaplaning?
Dermaplaning is something that I don't quite get, apart from the fact that it kind of removes all the vellus hair and probably makes your skin look smoother. But I know, I'm sure there's a lot of
maintenance.
I'm sure there's a lot of people that, possibly. I'm sure there's a lot of people that think it's great, and you might have a different opinion on it. But it's really an exfoliation technique and removing the vellus hair on the face, right?
It is, and it's quite interesting. I came to it during the pandemic. And one of my patients told me about this home dermaplaning device, which I don't have any shares in it. But it was quite interesting because, again, what is not discussed is the darker skin types get post-inflammatory hyperpigmentation. So, I'll declare that we have mustaches and we have facial hair, which is very difficult to manage. And, typically where we thread it or wax it, darker skin types will get post-inflammatory hyperpigmentation. And dermaplaning is quite fascinating because I moved to it and moved my daughter to it during the pandemic, where we couldn't go out anywhere and we couldn't get our facial hair threaded or treated. And actually, your hair doesn't grow back thicker or coarser. It takes off the superficial layer of the skin and therefore just allows your actives to be absorbed better. You know, it's just taking off the keratin. It's taking off the thicker
like an
layer.
exfoliation.
It's like an exfoliation.
And it doesn't leave the hyperpigmentation that
it doesn't
you were saying
at
other
all,
techniques
at
do.
all. So, you know, it was
Why is
quite a
that?
revelation. It's, if you do it correctly, if you cut yourself while doing it, obviously you're going to get a hyper. But it was quite a revelation. Cheap as chips. I mean, I don't want to promote the product because I don't get paid for it. But, you know, it was really very useful. And it's as a home technique once a week. And then apply your product.
Yeah, so I use a lot of dermaplaning. So dermaplaning, there's two different types of dermaplaning. So dermaplaning is using a surgical blade and there's a specific surgical blade which you shouldn't be able to get online.
Yeah.
That's to remove the upper layers of the skin. So it's a surgical exfoliation. And it's a very, very specific technique whereby the goal is not to remove the hair, but rather to exfoliate the skin. So you have two different types of hairs. You have the terminal hairs, which are the ones on your head, and then you have the vellus hairs, which are these. If you touch your face, you can feel these tiny, tiny hairs that are everywhere. And so in exfoliating the skin, the vellus hairs will come off, but the terminal hairs should not. So once you've done your dermaplaning, it's like a very superficial peel. And then, as Sabrina said, you can then put different products to do different things that will penetrate deeper into the skin, because of now you've essentially removed the very top layer of the skin. But there are some really great devices that use the idea of dermaplaning, and rather than having a surgical blade, which you can't use, they have, it almost looks like a little shaver, so it's safer. So if you go like this, you're not going to slice off the top of your face. But then this is, again, a bit like microneedling. When you do it at home, you're using 0.2. When we're doing it in clinic, we're doing 0.5, 0.1, 0.2 millimeters. You know, we're doing much deeper, 2 millimeters even. Same with dermaplaning in the clinic. You're using a surgical blade and you're surgically exfoliating the face. When you do it at home, it's a much more gentle treatment.
You always up the ante in the clinic.
Yeah, exactly.
But why would dermaplaning be preferable to a peel or sort of an enzymatic exfoliant?
So
it sounds quite involved.
Well, dermaplaning can be done without prep. So a lot of the peels that you do, you have to prepare the skin. So you have to be on the right products. You have to get your skin ready to have a peel. Whilst with dermaplaning, you can exfoliate the skin day one. And when done, you know, there's a specific technique. And when you use a specific technique, it's very uniform. So it's one of those treatments that a lot of people who are doing red carpet treatments or need something straight away so that the makeup sits on their skin. Like, I need glass skin right now and I don't want to do the work. So if someone needs to have, so it's a treatment that I do in the clinic. If I see someone that has a lot going on with their skin and they have a big event and we need to get a really good result that is temporary, but a really good result straight away, we'll dermaplan and do a peel. And that evening they can have makeup on and their skin looks glossy and fresh and lovely. And then we're like, okay, come back and you'll do the work.
Yeah, exactly. So it's a bit of a sort of quick fix.
It's a quick fix.
Yeah.
It's a very lovely quick fix.
Oh, I'm very interested by that. Thank you for raising that question. Were there any more questions? Oh, yes, one here.
Sarah, that's a question to you. What are the 3 new ingredients that we haven't heard of?
Wow, just to put you on the spot.
Yeah, that's quite a difficult one.
What are in your products that you're formulating for 4 years' time?
There is, I mean...
We'll buy shares in them all now.
Yeah, there is always research on different ingredients. I think there's a lot of research into how to get vitamin A into a more tolerable form and a more deliverable form through encapsulation or... and vitamin A has various different pathways to turn it into the active vitamin A, as we know, in the skin. So more recently, it was more retinaldehyde being used in encapsulation. And so there's more and more sort of work being done in that whole arena to see how we can get more sort of potency from our vitamin A, but less irritation. There's a lot of research into the microbiome and how we work with the skin in terms of that. And other research into ingredients is often going back to things that we know work, but it's how they can now be sort of formed, whether they're created in a lab, where they're fused with something else so you get a better delivery. And so it's much more that, using drone technology to be able to target them so they attach to specific sort of parts of the cells and different areas in the skin. So it's more that than there's a sudden brand new thing, unless it's a new plant that's been discovered somewhere. But I work much more with adaptations of things that we know already really work and sort of lab created, as opposed to just sort of botanicals.
That's reassuring. So it's sort of the things that have the science backing rather than just the latest trendy situation.
Yes, rather than some tropical place that's just found a tree that's got a bud on it that does
you saw on
something.
TikTok.
Yeah.
So unlike olive oil, which
Yes.
miraculous olive oil that was...
Is that Beyonce? Yeah.
Yeah.
No, J-Lo.
No, J-
God.
J-Lo.
J-Lo olive oil.
Yes, please.
Hi. I'm 57. Yes, I do provide anything, but I'm on social media every day, and I see 12 clients a day. I'm a nutritionist. I've just noticed all the red veins. Yeah. What would you recommend that has what would be the best with the least downtime?
Okay.
Because I really can't even take a day.
Okay, so in terms of ingredients, azelaic acid is one of the most helpful, and the
No, I mean I think
treatment without downtime. The least downtime would probably to use either a laser, very, very small spot size, low joules, turn down the joules, and so we have a 2 millimeter spot, and we literally don't treat everything, just the vessels. Okay. That would be one option. Mm-hmm. Another option would be to use like advanced electrolysis, where we have like an F3 needle, which are tiny. And so you literally go into each of the vessels and just cause coagulation. Then you'd have mild crusting. You could wear makeup, no one would know. Those would be two of the treatments that would reduce them with minimal downtime.
Any more thoughts from our panelists?
No, I
all in agreement.
And I think either of the things that you've suggested, you can put makeup on and you can hide it. We see that a lot. So people wouldn't even notice. You might notice a little bit of darkening of the vessel where you get the coagulation, but it's nothing more than a freckle, and you can put makeup on top and it's not noticeable. And with a ring light, then yes, just sorted.
Everyone's best friend. Were there any more questions? I don't think we've... Oh, yes.
You spoke about scar treatment sort of right after a treatment, but do you have anything for a scar that's maybe a couple of months old?
Yeah, I mean, a couple of months old scar, if you've not done all the things to try, a massage is very good. You can even do bio-oil massage. You can put dermastick or kilo-coat gels on it. Because up to 6 months, you will see an improvement. And you can microneedle. Microneedling is very powerful for these kind of scars. It depends on the depth of the scar, you know.
Does it make a difference if it's raised or sort of just pigmented?
I mean, basically you want to break down the scar. And you can laser resurface too. Again, it just depends on the depth of the scar.
Okay. I mean, it was a pretty deep scar that had like stitches in it, for example.
Yeah.
Would you still recommend microneedling on top of that?
Mm-hmm.
Yeah, which area is it? Is it enough? Yeah, I mean, that's an area that's always going to be hard. You might want to try intralesional steroids in it, and then, you know, the microneedling or the laser. But that's over a joint. So those areas are always, and it might be hypertrophic scarring, so it needs to be, you know, looked at. But yeah.
And silicone gels are great.
Yeah.
Silicone gels are excellent at flattening a scar that's like 6 to 8 weeks.
Yeah.
And you use them for a year, they're really good. PRP, wonderful too.
Yeah, anything that can get the growth factors into it as well,
Yeah.
I imagine, to stimulate that regeneration.
And home, just as Sabrina says, home massage in the early days, really good.
Questions? I think so. Okay, I thought I saw one more hand. It's Pavel with his video camera at the back. Thank you so much, everyone. And I think really a huge thank you to our amazing panelists.